It says 33-year-old woman is brought to the emergency department 30 minutes after being rescued from fire in her apartment. She reports nausea, headache, dizziness. Physical examination shows black discoloration of oral mucosa. A pulse oximetry shows oxygen saturation of 99% on room air. Substance most likely causing symptoms in this patient primarily produce toxicity by which of the following mechanism? It's a very easy question, so we'll just so what is this patient having toxicity from? Toxicity from which drug? It's a carbon monoxide poisoning. Rise in serum pH. This is seen in respiratory. Alkalosis. This is seen when patient is having difficulty breathing or they are high up on the mountain. This causes respiratory. Oxidation of Fe2 plus. This is seen as methemoglobinemia, and most commonly methemoglobinemia is seen in patient using drugs like dapsone. Okay. Degradation of 2,3-BPG. Remember, what does 2,3-BPG does? 2,3-BPG stabilize deoxygenated form of hemoglobin. So whenever the 2,3-BPG is decreased, there will be decreased delivery of oxygen to the cell. Remember, what 2,3-BPG does is it stabilizes the deoxygenated form of hemoglobin. Inhibition of 2,3-BPG enables the faster delivery of oxygen to the tissue. Remember, and inhibition of factor mitochondrial factor 5 is mostly seen with some toxicity with arsenic mitochondrial complex. Okay, let's go through the notes. So here you can see carbon monoxide poisoning. It's most commonly seen in smoke inhalation injuries, or they can have defective heating system where they're inhaling lots of carbon monoxide, or if they are stuck in poorly ventilated areas like garage, if they are stuck with motor that's operating and they are stuck in the garage, so they are seen with carbon monoxide poisoning. So most common effect manifestation is seen as mild to moderate. They have headache. Remember, they have headache is the most common manifestation in mild to moderate. While severe, you can remember as they have seizures or syncope. Mild to moderate, they have headache, and in severe, they can have seizures or syncope, or they can go into the coma. Diagnosis we do is arterial blood gas. We measure the carboxyhemoglobin level. We also do ECG, and we also check for cardiac enzyme if there is ischemia or coronary artery disease. We give them treatment with high flow 100% oxygen. So what does oxygen does is oxygen decreases the half-life of carbon monoxide. So usually if we don't give oxygen 100% oxygen, the carbon monoxide half-life is 12 hours, but if we give the 100% oxygen, it's reduced to 3 hours. So again, after we giving oxygen, we measure at the 4 hour. Again we measure ABG or arterial blood gas, and we can give intubation or hyperbaric oxygen therapy. You can see its competitive binding of oxygen here, where oxygen should bind. Carbon monoxide binds tightly, so there will be less available site for. I forgot to add this one, acquired methemoglobinemia. This is most commonly seen with dapsone or any tropical or local anesthetic like benzocaine or teething medication. It's also seen with nitrites or nitrites, that is seen in drinking groundwater. This causes oxidation of heme from Fe2 plus to Fe3 plus, and Fe3 plus is unable to bind oxygen. Oxygen affinity to any other heme is increased, causes left shift of the curve, and causes decreased oxygen delivery. Remember, arsenic poisoning, it disrupts the cellular respiration and gluconeogenesis. It's bound to sulfaldehyde.
Thanks for watching. Please give a thumbs up and subscribe for more.